or the reconstruction of the accident that they did said that the driver came up over a blind hill. He was speeding, they worked that out, and apparently I was crossing the road, it was raining, just enough to wet everything, not pouring, and I was wearing high heels because I was going to a wedding, and I've looked up, seen the car, tried to run, unfortunately fell over and ended up on the roadway, and the car just went over the top of me and dragged me, I believe it was 27 metres, they worked it out.
So polytrauma is a disease which is pretty obvious from the beginning, because you realize that this patient has multiple body regions injured. Those are severely injured, maybe individually life-threatening.
I remember that my skull, I believe, was fractured in 3 places. One of them was around here that resulted in me losing my hearing in the right ear. I broke my right collarbone. I'm not sure, but I believe I was told I had a fractured pelvis. I had a compound fracture on the left leg and the bone was actually broken off. I had the left side of my butt completely disappeared somewhere on the roadway out there.
Once the patient gets to the hospital, or even before that, we know about this patient's arrival. So a specialized team of clinicians, so-called trauma team, is getting prepared in the highest acuity area of the emergency department. And we try to perform surgery, whatever life-saving, as soon as possible, and so-called function-restoring surgery within reason, again, as soon as possible.
I remember the first thing was a nurse telling me, you're in the ICU, you've been run over. And I remember Zsolt. Now, I don't remember seeing him, but I remember hearing him. I basically had surgery almost every second day I was in there. Sometimes it was major things like a skin graft or a bone graft, and sometimes it was just going in and cleaning out the wounds. But every day required me to go up to theatre, every day required me to fast.
This severe injury causes also inflammatory response. So the body has a systemic inflammatory response to this injury, similar like what you get for infection or any other major insult to the body. These insult and inflammatory response can cause organs to shut down. And these organs, vital organs, can be those ones which not even involved in the initial injury. A typical example is somebody have a broken femur and some injuries to the liver or spleen, and day 2, day 3, they develop lung failure or kidney failure, organs which hasn't been injured by the trauma.
At this point, I had absolutely no idea that I had kidney issues. Came in with pneumonia, and when I left, I found out that they'd done all the testing and told me that I had a kidney disorder.
So that's why we started to work under my leadership with the WHO to recognize this condition as a disease. So it's not a virus, not a crazily multiplying cancer cell making the body sick, just this energy is transferred to the body. And now we know that we don't need to kill the cells with this energy transfer. Sometimes the shaking or compressing the cell is enough to make them dysfunctional. And once a cell is dysfunctional, the organ, the tissue gonna be dysfunctional, and the whole body not gonna function very well. But once they recognize as disease, they have a very different focus, and clinicians and policymakers tend to treat the crux of the disease rather than the symptoms. For example, we trauma surgeons unfortunately still treat most of the time just the symptoms of the disease. But the crux of the disease to interact with the cells at the level when they have this initial kinetic energy transfer and became dysfunctional.
They are working so hard to try and make things better for patients, to find solutions for problems that are going to happen or have happened or will happen. They really need all the support that we can get. I'm willing to talk to anybody at any time about it if it can help somebody.